This video was filmed during the SARS-CoV-2 pandemic, the virus that causes COVID-19. The entire team wore surgical masks to adhere to the Centers for Disease Control and Prevention recommendations for universal source control.
Welcome to our live report on hand hygiene in America. I'm Jan Sparkles, a registered nurse and a healthcare reporter with WPPE News investigative reporting team on our way to a local healthcare facility right now. We all know that healthcare providers work hard, provide a critical service. But the CDC reports on average healthcare providers are washing their hands less than half the times they should. This may have improved recently, but there's still work to be done. So what's really going on here? Today, we're going to find out. Okay, are we rolling? Are we? Okay. Hi everyone, we're about to walk into the building. It's going to be a wonderful day. We're gonna learn all about hand washing.
Hey guys, what you doing today? What? Oh. Yeah, that doesn't, I'm not.
Yep. Let's see how these healthcare providers are performing hand hygiene on a daily basis. Excuse me, sir. Jan Sparkles with WPPE News 13. Do you have a minute?
Sure, I have a couple minutes. What's this about?
Glad you asked. We're doing a kind of survey on hand hygiene. We're asking healthcare professionals like yourself to demonstrate how they perform hand hygiene and talk about best practices. What do you say?
Sure.
Do you mind demonstrating how you perform hand hygiene?
Well, I usually wash my hands here in the sink when I get to work, and throughout the day we use hand sanitizer. So you want me to wash my hands?
Mm-hmm. Please. Okay, good job overall. A couple of points I'd like to make though.
Okay.
First off, you spent about 15 seconds, which is good, but if done the way the CDC recommends, you should rub your hands together for at least 20 seconds. So just a little bit longer. I'd like to show you the official CDC recommended procedure.
Oh, okay, great.
Actually, we need someone to demonstrate. Camera guy, Bob, right?
John.
John. You know how to do this right from the training we had to do.
I guess so.
Okay, well, come on over here.
It's hired to do camera.
All right, first wet hands with water. Apply soap. Rub the hands together vigorously for at least 20 seconds. Scrubbing between the fingers, underneath the fingernails, between the digits. The back of the hands, the palms up to the wrist, covering all surfaces, focusing on the fingernails and fingertips. Rinse with warm water. Dry with a disposable towel, and use the towel to turn off the faucet.
That's pretty detailed.
Yeah, it seems like a lot of steps, but once you get that muscle memory down, you don't even think about it. Well, I want to thank you so much for being a good sport. We'll let you get back to work. And
Thanks.
no, thank you.
I appreciate the tips.
No, I appreciate you. Oh. We've got to go to a commercial break, but when we come back, we're going to talk about hand rubbing with alcohol-based hand rub.
You should use soap and water and when your hands are visibly dirty or visibly soiled with blood or other body fluids. When washing hands with soap and water, the Centers for Disease Control recommends the following. 1. Avoid using hot water to prevent drying of the skin. It is not necessary for the water to be hot in order to be effective. 2. Apply the amount of product recommended by the manufacturer. 3. Rub your hands together vigorously for at least 20 seconds. 4. Cover all surfaces of the hands and fingers. 5. Use a paper towel to turn off the faucet and to open the exit door. When your hands do not have visible dirt or other contaminants, the CDC recommends using an alcohol-based hand rub instead of soap and water.
Probably to 10. Just to...
is not a bad thing, right? Hi, doctor. Do you have a minute to talk about hand hygiene?
Sure, I have a couple of minutes.
We're surveying healthcare personnel to assess their knowledge and practice of proper hand hygiene techniques.
Okay.
Can you tell us when you use an alcohol-based hand rub?
Pretty much before, after having any contact with the patient's residence, after touching anything like surfaces or equipment in the room, and after removing my gloves or any other PPE.
Excellent. Can we demonstrate a technique for you and get your reaction?
Sure.
Bob.
On it.
Our cameraman, John Bob, has had a thorough CDC training in hand hygiene.
John.
So, first, apply product to the palm of the hand. Rub your hands together, covering all surfaces, focusing on the fingernails and fingertips. And rub your hands together until they're dry.
Yeah, I pretty much do that, more or less.
Yeah. It's really pretty simple, just palm to palm, back to front, palms, thumbs, fingertips. Yeah.
That's the beat, Bobby.
Oh.
Palm to palm, back to front, grab it, palms, thumbs, fingertips. Yeah, yeah.
Everybody join in.
Palm to palm, back to front, grab it, palms, thumbs, fingertips. Yeah, yeah. Everybody join in. Palm to palm, back to front, grab it, palms, thumbs, fingertips. Yeah, yeah. Everybody join in. Palm to palm, back to front, grab it, palms, thumbs, fingertips. Yeah, yeah.
Healthcare-associated infections are a major, yet often preventable threat to patient safety. Each day, approximately 1 in 31 U.S. patients contracts at least one infection in association with his or her hospital care, underscoring the need for improved infection control in U.S. healthcare facilities. We touch everything with our hands, from our phones to doorknobs to medical supplies. Even though most infections are transmitted via the hands of healthcare personnel, we have learned on average healthcare providers clean their hands less than half the time they should.
Are you actually getting this right now? You know you don't have to get this right now. We're just walking. All right, and we're going. Hi, WPPE 13 News, how are you today?
Good.
We're surveying healthcare professionals about hand hygiene. Would you like to participate in our investigation?
Do I get paid?
No.
Okay.
Let's talk about when you perform hand hygiene. At what times do you hand wash or hand rub?
When I get to work, before contact with a patient, before meal breaks, after bathroom breaks.
That's right. Hand hygiene should be performed after contact with blood, body fluids, excretions, secretions, contaminated items, before and after patient or resident contact, before or after contact with the patient or resident's environment, and immediately upon removal of gloves.
What if you leave on your gloves and you use hand sanitizer with your gloves on?
No. That's a no-no. Hand hygiene should be performed after leaving the patient or resident's room, and hand hygiene should be performed always, just always.
Knew that.
Yeah, gloves are not a substitute for hand hygiene. So, when do you perform hand hygiene?
After contact with blood or bodily fluids, patients, contaminated items, before and after wearing gloves.
Yay,
Gotcha.
excellent. You get you get a gold star.
Yay!
All right, well, thank you so much for your time.
Way to go!
We are off to see whom else we can interview.
Good job, man!
Bye.
We'll be right back after this commercial break.
There are many ways individuals can work to improve hand hygiene practices. In addition, the organization can also take these important steps. 1. Involve staff in the evaluation and selection of hand hygiene products. 2. Provide employees with hand hygiene lotions or creams compatible with soap and/or antibacterial hand rubs. 3. Provide hand hygiene education to your staff. 4. Monitor staff adherence to recommended hand hygiene practices. 5. Provide feedback to staff in compliance with recommended hand hygiene practice.
I wonder if it's. Whoop, whoop, doo, 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 doo. That was open. Hey, Naomi.
Jan, what are you doing here with these people?
I work for the news now. Yay.
Cool. So what are you doing here?
We're investigating best practices of hand hygiene in healthcare settings, and we would love your help.
You got it. What do you need?
So we've already spoken with your coworkers about hand rubbing, hand washing, best uses of hand hygiene. We would like a little insight into why hand hygiene isn't always used appropriately.
Well, that's a serious issue, and I think that there can be a number of reasons for that. One person I knew said that hand sanitizer solution irritated his skin, so he didn't use it as often as he should. And sometimes we run out of supplies.
How about gloves? Do you think people think that eliminates the need?
Yes, I have heard that some people think that if they're wearing gloves, they don't need to perform hand hygiene. And realistically, sometimes people are in a rush and just don't think about it.
It's hard because everything you do is important in patient and resident care, and I know the task at hand can be a real distraction.
They can, and we're working to change that because proper hand hygiene is also critical to patient safety.
Healthcare infections are the leading cause of illness and death in healthcare settings, and hand hygiene is our first line of defense. You know, we actually came up with a dance for it. Do you want to see it?
All right, yeah.
Palm to palm, back to front, grab it, palms, thumbs, fingertips, yeah, yeah. Everybody join in.
Palm to palm, back to front, grab it, palms, thumbs, fingertips, yeah, yeah.
Everybody join in.
Palm to palm, back to front, grab it, palms, thumbs, fingertips, yeah, yeah.
Everybody join in.
Palm to palm, back to front, grab it, palms, thumbs, fingertips, yeah, yeah.
Everybody join in.
Remember, hand washing and alcohol-based hand rubbing should be something you don't have to think about. Do it right every time, and we will all be safer and healthier.
That's it for our live report on hand hygiene in healthcare settings. Please be careful and happy hygiene.
That's the beats, Bobby.
Palm to palm, back to front, grab it, palms, thumbs, fingertips, yeah, yeah, everybody join in. Palm to palm, back to front, grab it, palms, thumbs, fingertips, yeah, yeah, everybody join in. Palm to palm, back to front, grab it, palms, thumbs, fingertips, yeah, yeah, everybody join in. Palm to palm, back to front, grab it, palms, thumbs, fingertips.